いろいろ、素晴らしいことがたくさんあったので、みんな長寿になったわけですね。ライフシフトなんて言って100歳まで生きようかっていうことになっている時に、かなりの人たちがだんだん年とともに認知症になってくるということですよね。そういうことが非常に大きな問題だなということがあって、キャメロン首相がね G8 のサミットに認知症サミットということをホストして、各国がそれにサインして、これからみんなで協力してね、やっぱり認知症の対策をどうするかということを考えようという会議がこの発足の基本ですね。
The World Dementia Council has focused in this meeting on our priorities for the upcoming year. So we're going to aim at raising more awareness. That's absolutely critical to this issue. We're looking to see what more we can do to help and advance care across the world. Absolutely crucial for those who are dealing with the disease today. Then we're aiming to increase the research so that we can ultimately end the disease, but also help with care and risk reduction, which is another key priority for us.
So the World Dementia Council is a very special group of individuals, and people who are there's 24 members of the World Dementia Council, are being invited for what they are as individuals. Of course, they come from the different areas and stakeholders involved in dementia, whether it's industry, charities, research, academia, and of course people living with dementia. We have a couple of members of people with lived experience. And so the World Dementia Council is made of those members. It also has associate members who are essentially the main global organization involved in trying to face the challenge of dementia. WHO, or OECD, ADI now is the Alzheimer's Disease International is associate members, and we have also as associate members a number of the countries who are truly engaged, globally speaking, in order to face the challenge of dementia. I will mention the Netherlands, Japan, Canada as example, and Australia as example of those countries involved.
I got involved with the WDC as a result, I was invited to join the council as a person living with dementia, and I think there are two things that I hope to get from being a member of the council. One is to let other people with dementia see what opportunities there are available to them around the world to get involved and to make a difference to the lives of people with dementia. But the other thing is, I think the council talk about very important subjects, and they're operating at a very high level, government level, policy makers and organisations like the World Health Organization. They don't see the reality of living with dementia and what happens day to day for everybody who's having to live with dementia. So I hope I can bring some reality to the council as a person living with dementia as to how they can help me and how I can help them.
So in the World Dementia Council, there are 3 representatives from low-middle income countries: Indonesia, India, and Nigeria. Their involvement is significant and crucial and instrumental because they highlight, they basically bring up how the matter of awareness, how important it is to have awareness raising, how important it is to get support from developed countries. There's issue related to women, for instance, because many caregivers in low-middle income countries, caregivers and people with dementia are mostly women. So this has an impact, the burden to the other diseases, including depression, cardiovascular disease, hypertension, and all that. So the involvement of representatives from 3 low-middle income countries in the WDC actually influence other members to realize how important it is to put low-middle income countries as part of the agenda to move forward.
The World Dementia Council at this meeting has decided to issue a report at the 5-year anniversary of the first World Dementia Summit to update the world on the progress that we've made, particularly on some objectives set at the summit by the G7 nations. That will be important, we believe, in advancing to the next steps to actually achieve those commitments made back in 2013.
I think what they can achieve is to make lives better, not just for the people living with the disease, but the people that help them, their carers, their supporters, their families. And we don't lose sight of everybody that's affected by the condition. So that's why I think the Council is ideally placed to make a real difference, to make things happen.
There's no other table of discussion or group of discussion and action that brings together all stakeholders relative to the challenge of dementia. There are groups and organizations bringing countries together, like WHO, there's group bringing industry together, and so on and so on. But here, the Council, and what I'm really proud of the work that has been done, inspired by the UK government and then supported by the members, is the fact that all stakeholders are there, and the Council is a microcosm of the tensions that exist between all stakeholders, industry, charities, people living with dementia. And this is where we kind of resolve these tensions, and we use these tensions to create actions which are not necessarily driven by the World Dementia Council, but that are driven by the different organizations from those stakeholders. So our role is to influence, amplify, and canalize and connect the dots of what is already potentially there, but is not moving fast enough in the area.
日本が世界でも一番の長寿国だし、その長寿の割合、例えば高齢社会ということでは、日本は世界で一番の高齢社会になってるんですね、国としては。ということで、もうほんと日本の存在、いろんなことをやっていることが世界にアピールできればいいんですけど、共通の問題としてはいろんな問題があるんだけど、世界中では日本がある程度ね、一番の高齢社会で、経済もあまり伸びてないところから言うとどういうことしてるのかなということが非常にお手本になるわけで、そういう意味では日本の、社会全体あるいは政府としてはどういうことをするかっていうのは非常に大事な、機会だと思いますね。来年は G20 について日本がホスト国をするわけですし、そういう意味ではアフリカのティカッドだけではなくてね、いろんな機会が日本の主導っていうか日本のにとっては発信するいい機会になっているので、パブリック・プライベート・パートナーシップ、その他の日本の対応の事例をですね、世界中と共有して、やはりしっかり日本がやっていることをみんなに知ってもらっている機会を作ることがすごく大事だと思っています。
So, one of the biggest challenges for the World Dementia Council and for dementia as an issue worldwide is to keep it high on the list of priorities for governments and all kinds of organizations so that we can advance ever faster. There are 50 million people today in the world who are facing dementia, and about 3 times that many caregivers already. And those numbers are set to increase to as many as 130 million people by mid-century, so not too far from now. We've got to get things done even faster.